we prepared the conference paper as well. Co-authors include Ravi, Dale, Sirac, and Michael Campbell. Later we will see it in a magazine, hopefully over the next few months' time. I will talk about some background first, then some digital twin technology that we implemented in our chiller plant, and why we do that. Then hot water heat pumps and sterilizers, and why we do that. And the last, some kind of thoughts on to net zero energy hospital. We are a quaternary hospital with healthcare, teaching, and research functions. And we are the only one children and public hospital in Queensland. We ranked number 10 in 2024 Newsweek Global Pediatric Hospital Ranking. That's something we are quite proud of. In terms of electricity use, here's a chart to show that the horizontal axis are the month, and the 3 years of real data, we can see it's a clear seasonal pattern. High electricity use for the summer month, and the lower electricity use for the winter month. And I will turn that data into something slightly different. So this is a correlation chart with 5 years, 60 months of real data. The horizontal axis is the temperature indicator. The vertical axis is the average daily electricity use over that 60 months. So there are 60 dots in this chart. I don't want to go too much into the math behind this chart, but put it into one sentence summary. The whole precinct electricity use is highly correlated with ambient temperature, and the 1 degree Celsius temperature increase will lead to 1.8 megawatt hour a day electricity use increase. Our hospital is about 5,000 households electricity use in southeast Queensland, and this 1 degree temperature increase will lead to about the increase of 140 households electricity use. And from this chart, of course, it means in summertime we would tend to use more energy. In wintertime, we tend to use less. But also on the other side, as the climate warms up a bit, we're gradually getting more and more electricity used. Here is a beautiful picture of our energy plant. It's well maintained, very clean, nice, tidy. That's something I'm quite proud of. So that's an energy plant with 6 electrical chillers, totaling of 18 megawatt hour of cooling power. And the reason why we look at chillers, based on real data, chillers, all the 6 together, is about 20% of our annual electricity use. What can we do? So in QCH Living Lab project, we implemented machine learning. The machine learning algorithm was used to build up a digital twin model for the chiller plant, so we can better understand the system in operation. For example, that's the COP. So this coefficient of performance is an efficiency indicator. And that horizontal axis is loading percentage, and that vertical axis is temperature lift for the chilled water. So for example, from this chart, we learned our chillers don't really work at highest efficiency when they are 100% loaded. So 80%, somewhere 75 to 80% is more like our optimum points. And with this digital twin model, we simulated hundreds of scenarios, for example, different external scenarios, temperatures, humidities, and also our operation loading. Then we optimized the control logic for the chillers. Here's the outcome. We saved 187 megawatt hour of electricity a year, which is equivalent to 34 households in southeast Queensland. The payback period was about 18 months. And what we are really proud of is we supported an Australian small company, Australian Innovation, taking off to the world. Now that company is implementing a digital twin model for shopping centers in North America, and also did the digital twin model and the chiller control optimization for Sydney Outport as well. And people may ask, what kind of funding source did you get to do this kind of project? It was an Australian renewable energy funded project. And the Australia ERA and also QLD were partners as well. Big data. People asking, wow, did you use big data? And based on my experience, probably more important is what's the right data? What's the data that you really need for your purpose? So that's probably more important than just a big data set. Next part is some people ask, oh, did you get some IT issue? And the security risk consideration, because we're thinking of data, the transfer of data from a hospital, live hospital, into another company. So in terms of that, at the beginning, the company proposed to have a black box model, kind of an instrument installed in our network. And I think you know how that went. So we refused that. That's something not so good. After some talk discussion, that we decided to go with 6 daily emails to the technology and supplier. So that went quite well. There was no IT security risk. There's an official report available online as well if we are interested. The next thing that we're going to talk about is hot water. Why looking at hot water? Because hot water is often the largest natural gas used in Australian major hospitals. And we know natural gas price have been volatile. It's very difficult to predict future, maybe going up or going down at different times. But I think we know what the future will be like. Probably will go only one way in terms of trend. And which season do we need more hot water? Intuitively, we may think in the winter, we will tend to use more hot water because we need heating. We need to burn natural gas, generate more hot water for heating. But that's probably not the case, at least not the case for us. So this is real operational data. Oops, sorry. 3 years of data from January to December. This is average daily natural gas use, and the largest amount of natural gas we use is for hot water generation, and then it's steam generation. So for us, that we can see, natural gas use is very high in summer month, and natural gas use become lower in winter month. So summer coincides with heat in the air. And if I interpret this, it's more like a love in the air. The reason why I say that is, can we move waste heat from air into water? It's a time that we need heat, because we need heat to manage our dehumidification, to support the dehumidification process in our hospital. And of course, that another related topic is mold and something else, right? That's maybe someone's favorite topic as well. Now, what can we do? Is heat pumps. In a simple way that as an electrical engineer, I don't understand much mechanical, but I'm learning along the way. Heat pumps are like fridges or chillers. They use electricity to move heat around. And this is a simplified conceptual diagram. So we have chilled water loops, takes waste heat from spaces, like waste heat from lighting, from appliances, and even from people as well, 80 or 100 watts, kind of that's how much power we use. And different people may have slightly different metabolism, but that's the philosophy. We use heat pumps to move the waste heat from the chilled water loop, move it into hot water loop. In that way, we generate free cooling and produce hot water at the same time. So that's the way we would like to go. And we completed the design, and we would like to have 2+1 high temperature hot water heat pumps. And they're expected to last 20 years service life. And based on our calculation, that the payback will be within 80 years, including demolition, pumps, piping, BMS, and project management cost, and everything. And after thinking about heat pumps, the next one will be relevant to our steam. Steam is our second largest natural gas use. Our natural gas use mostly happens here at the energy plant. So that's our beautiful energy plant, and that's the hospital on the other side of grassy knoll. And the clean steam generators are on the 6th floor of this building. CSSD is the major steam use, and that's on level 5 of a hospital. And here comes to a question. So I would like to give a bird's eye view first. So the boilers are here in this energy plant, through underground tunnels, a few hundred meters to our hospital. on level 6, clean steam generators, and then go down level 5 to the CSD. What's the percentage of energy lost in the steam supply system? Does anyone agree that is 20%? That's no? 30% lost in the supply? Yeah. Next one is 40%. Yep, more people. Yep, thank you. The last one is 50% or more. Yes, okay. So probably some of us, were in my previous presentation last year. Yeah, I'd say yes. 50% or more. That's the answer. And globally, a study shows probably 60-70% energy is lost in the supply. So that's how much is lost. If we have the centralized steam supply for major hospitals. What can we do? So we are doing the design stage of a CSD replacement. We would like to go with sterilizers with point-of-use steam generation. What that means is in old times and our existing sterilizers, we didn't have a point-of-use steam generation on here. But for future, we have RO water supply to our sterilizers, and we have steam generation on top of the sterilizers. So we remove the need for clean steam generators. Our hospital is about 11, 12 years old, and for those assets are actually near to the end of their service life. So we're taking the advantage of having the replacement of asset, along with some improvement opportunities. This is one of them. So the savings, so it's 85K per annum utility saving, some steam boilers inspection saving, if we can reduce or eliminate the steam boilers in the energy plants in the future. And the ongoing and the life cycle cost, that's for our clean steam generators. In terms of return on investment, because here we have a slightly increased cost for our sterilizers, because the new sterilizers are different to our old sterilizers. So we have increased cost, that's true. And in terms of ROI, the savings compared to increased cost, actually we can get it back within 2 years. So it's not bad. Next one. So we had some thought about and discussion about net zero energy and net zero targets for New England. That's wonderful. That's in our view, probably it's not that easy or not possible to have net zero by the hospital itself. For example, rooftop solars cannot really make it, really net zero. Or even with energy reduction in efficiency measures, probably will never get to net zero because we are very heavy energy users. But can we get to net zero emission in other ways or with other methods? So here's a bit of background. Queensland Audit Office, the recent report for 2025, Queensland Health is roughly 51% of the total Queensland government greenhouse gas emissions. And people may argue, what's the scope of the emission report and what's counted, what's not counted. I don't go that way here. So that's based on this report, 91 to 93% of this emission coming from electricity over the period, so 2020 to 2024 for financial years. Hospitals, we use a lot of electricity. And the question comes, what are the ways? How can we do net zero? Is it really possible for energy, for example? And here's a chart of our hospital last 10 years emission profile. The gray bars are electricity. So this is the electricity scope 2, electricity scope 3 emissions, natural gas scope 1 emission, and the natural gas scope 3 emissions. So electricity is our main part of our emission, we can see from the charts. And natural gas and diesels are in use as well. What can we do? So possible options, green power purchase. Next is carbon credit market. Number 3 is, can we consider more electrification options, considering future grades of higher renewables? Our research or some calculation analysis demonstrate actually, green power purchase always provides value for money. And it provides value for money when electrification happens, especially when in the future grids we have a higher percentage of renewables. So that's let me finish the presentation with a quote. The best way to predict the future is to create it together. I would like to thank the great team effort from our clinical, our BENS team here, project delivery, ICT, DOH, industry partners, and our Delta FM, our external, our outsourced contractor for our maintenance efforts, ERA, Arena, QUT, and our leaders here in the past or present. Thank you.